First of all, thank you for being here. We really appreciate at Bioelectronics and Team ActiPatch you guys attending this webinar. I just hope to, we have two attendees here, the panelists. Myself, I'm Sree, and then Ian, who's our Clinical Research Director. We will provide you an overview of what the ActiPatch is, how it's different from other products, the basis behind chronic pain, and other related fields. And in the end, we'll be happy to take questions. I just want to point out that in the end, there will be a drawing for a gift card for all the attendees. So please stay tuned till the end. I will let you know personally who won. All right, so let's get started. So this webinar has been prepared for the team at the Comprehensive Pain Specialists Group, and we thank you for being here. So first of all, a little background about myself, Sree, and then Ian, who's also on the call. My background is I'm a biomedical engineer and I lead product development here at Bioelectronics. And I specialize in developing new medical devices, such as the ActiPatch for clinical applications, in this particular case, musculoskeletal pain. And then Ian has a background in wound healing and other research, and he has plenty of clinical research experience, and he has spearheaded much of our clinical research program. So any clinical related questions, anything like that, feel free to direct it to him. So first of all, I just want to walk you through the prevalence of chronic pain and what the definition of chronic pain is. So clinically, we understand chronic pain as pain that lasts, that has been persisting for at least 3 months. But we would like to present with a different definition of chronic pain as pain that persists, or pain that lasts even after the underlying injury or what's causing it has healed or has been solved. So just a little bit on the demographics. Chronic pain leads in the leading cause of disability in the United States, even with the next 3 causes of sufferers combined. So in this case, we have about 1 in 3 Americans suffering with some level of chronic pain, and almost 1 in 4 physician visits are for pain. Now, a lot of this chronic pain is musculoskeletal in nature, 80% to be approximate. And what I mean by musculoskeletal pain is pain associated with pain related to joints, arthritis, lower back or upper back, or any sprains or repetitive injuries such as plantar fasciitis, shin splints, etc. Now, it's common knowledge that pain has a significant impact on a patient's quality of life, mainly because it inhibits them from moving and doing other things that they normally would without their pain. Now, the reason your team is listening to us at this point is we understand that drugs and other electrical therapies like TENS, they have some efficacy, but they're limited in what they can achieve. So why is this the case? To walk you through why this is the case, I'd like to take some time and present to you how normal pain signaling works and how it looks when the pain signaling becomes abnormal. So in the case of normal pain signaling, let's take a look at the image on this slide here. And this is in the case of normal sensations, people with regular pain pathways. So I've just noted that there's nociceptors and mechanoreceptors here as part of the sensory nervous system. So in the top part of the figure, any harmful sensations like fire or piercing sensations or chemical sensations, they activate the nociceptors, which relay the information as pain signals to the brain so you can withdraw from the source that's causing the pain. That's normal. And in the case of mechanoreceptors like touch, it transmits signals and gets registered as touch. So in a normal individual, we're able to distinguish between pain and sensations of touch pretty easily. And similarly, in the bottom part, you can see that if you use a feather or even a pen of something, it just activates the mechanoreceptors. This is what happens in normal individuals. However, in the case of people with chronic pain, a constant triggering of these nociceptors can oversensitize the system or sorts overload the system. And this leads to a condition called central sensitization. This is very similar to the development of an allergy. So in the beginning, an allergen, a person can tolerate lots of quantities or amounts of the allergen and not react to it. But over time, the person's immune system gets overly sensitive and reacts to even small amounts of allergen, let's say like a peanut butter allergy or other related allergies. Chronic pain is also similar. When this happens at the central nervous system level, it's called central sensitization. And let's take a look in the next slide at what happens in individuals with central sensitization. Now, in central sensitization, your nerve cells essentially learn pain. So pain lasts even after your underlying injury has healed. An example is people with knee osteoarthritis. So if you compare radiological images of damaged knees versus the amount of pain that a person feels, it is understood that there's no correlation. So a person with less damage can feel more pain than a person with more damage. And clearly, it's not the damage that's causing the pain. So as you can see in the image here, a person with central sensitization, harmful stimuli that would normally lead to pain, in a person with central sensitization, it would cause excessive pain and what we recognize as hyperalgesia. However, in these individuals, normal sensations like touch also get registered as pain instead of touch, which is allodynia. So the classical features of central sensitization is that it results in amplified pain, and the pain is unrelated to the level of underlying damage. So we'd like to present that a lot of chronic pain conditions, especially musculoskeletal pain conditions, may happen due to a sensitization of the nervous system. And just to summarize and see where the treatment lies, let's walk through this flow chart. So what leads to central sensitization? The first step is constant peripheral activity from an injury or lifestyle. Let's say running or lifting heavy loads can traumatize the nervous system. When this happens repeatedly over time, it leads to the development of nerve hypersensitivity, a state where your nerves start to react excessively even to normal amounts of signals. And this leads to central sensitization. Now, conditions like chronic pain, restless leg syndrome, fibromyalgia, irritable bowel syndromes, and migraines, they have all been linked to central sensitization. So the key here is that to treat the disease, we don't need to mask the conditions or treat the symptoms, but we need to treat central sensitization, since most of these conditions are just clinically manifesting themselves because of this condition. So now that we've spoken about central sensitization with pain, let's look at what existing treatment options are out there. So the OTC treatment options, there are broadly three categories. One is oral analgesics or topical analgesics, and the third, obviously, is the opioids. So how do oral analgesics work, like ibuprofen or Tylenol and other related analgesics? They try to block pain and try to reduce the inflammation. Now, while trying to reduce inflammation can be helpful with acute injuries, as you can remember, pain is often unrelated to the underlying level of damage. So chronic pain does not always correlate with an underlying level of inflammation. So oftentimes these medicines may not provide the full level of relief that a person is seeking. And long-term side effects are common when using these medications. Which brings us to the second category, topical analgesics like heat wraps or ointments. They do work, however, they only work temporarily and provide a masking sensation. The example is, let's say an individual bumps their hand against a wall and it hurts. As long as you rub the area, there is pain relief because you're masking, but when you withdraw the stimulus, your pain comes back. And the alternative that's being pursued in America these days is the use of opioids for pain. And in fact, it is said that the inefficacy of these existing therapies is what is leading people to try opioids. The CDC notes that non-pharmacological options and non-opioid options are preferred for chronic pain because more and more clinical evidence is telling us that these treatments are not working. So what prescription or alternative treatment options are available? There are non-opioid pharmacological options like centrally acting drugs like pregabalin, gabapentin. They do have some limited efficacy for chronic pain, but the side effects are quite severe and can actually decrease the quality of life much further. Which brings us to non-pharmacological therapies like behavioral therapy, meditation, mindful practices. They do have some efficacy for chronic pain. However, they're expensive, require a significant amount of time commitment, and almost always they have a high learning curve. So it's not feasible for most cases, and especially with healthcare services in America were already overloaded, so this is going to make it additionally expensive. So just to summarize, for chronic pain that has a neurological origin, the best treatment is to provide new peripheral information to reverse the central sensitization. The idea is that if you reverse central sensitization, the pain automatically starts to reverse its learned pathway. Exercise is one way of providing that information, but an individual already in chronic pain can find it very difficult to tolerate the temporary discomfort. So what options are there? At this point, I'd like to present to you the concept called electroceuticals. Just like pharmaceuticals use drugs to provide therapeutic benefits, electroceuticals is just an umbrella term for any modality that tries to provide therapeutic benefit by regulating nerve activity. And when we try to regulate nerve activity, it's called neuromodulation. So the goal of electroceuticals is to use neuromodulation to target an underlying nerve and provide an end therapeutic benefit. So broadly, electroceuticals can be classified in two ways. One is invasive options and the other is non-invasive options. So invasive options have been around for a while. Methods like acupuncture or percutaneous electrical stimulation or spinal cord stimulators, these are all examples. In fact, pacemakers is the earliest known electroceutical because it is implantable and it uses electricity to improve the cardiac rhythm. Now, with non-invasive options, there's mainly two types of technologies. One is contact-based technologies like TENS units like Icy Hot, all the other ones we see on the market. They require skin contact and they place electrodes on the skin. The idea is they pulse electricity through the skin to reach the underlying nerves. Now, there's some efficacy and there's some benefits for using TENS. However, there are some issues because not all patients tolerate paresthesia, the tingling sensation, very well. And especially the elderly with fragile skin, it can actually cause skin problems for them. And most importantly, TENS units cannot be used for more than 20 or 30 minutes at a time because the individual adapts to that stimulus. Which brings us to contactless electroceutical technologies. And the ActiPatch belongs to the class of electroceutical technologies that does not require any skin contact and does not result in any uncomfortable sensations. So what's the ActiPatch? Let's just talk about it a little bit more. What keeps it different is the fact that it's sensation-free, can be used 24/7, and it is also a neuromodulation technology. Now this slide, let's look at the image of the ActiPatch itself. On the top left, the therapeutic area is actually the area inside the wire loop. Sometimes we get questions from practitioners who've been used to TENS. They tend to think that the area underneath the battery is the treatment area. But in the case of the ActiPatch, the treatment area needs to be inside the loop. So you would just center the source of pain inside the loop. And just on the right-hand side, comparing ActiPatch to analgesics and some TENS, you can clearly see the benefits of ActiPatch, mainly because they can be used 24/7. There's no harmful sensations, no side effects that we've documented significantly that can cause any harm, or even from a cost perspective, it's much more effective than other alternatives. From a safety perspective, the FDA, Health Canada, the Australian government, and the European Union have all recognized the ActiPatch as safe and helpful in treating some types of musculoskeletal pain conditions. So how does this ActiPatch work? What it does is it uses low energy, high frequency electromagnetic pulses 1,000 times a second. And the idea is that it's just tapping on nerves 1,000 times a second to get it to respond. And as I said, there are no harmful side effects. And the benefit is that it can be used over clothing 24 hours a day. So even with bandaged wounds or any fractures or any sprains, it can be used on top of existing clothing or taping methods. So how does the so now that we know the ActiPatch neuromodulates, how does it actually help with pain relief? The idea is that ActiPatch reduces central sensitization through its neuromodulation effect in the following way. It habituates the sensitized nerves to the paresthesia signal. So the analogy here is, imagine your sensitized nerves as an agitated child. If you give the agitated child something safe to do for an extended period of time, in essence, you make them forget what they were doing in the first place. And so that's how the ActiPatch actually works. It overloads the pain pathways with the safe information that overloads the system. And so the nervous system is now tuning itself to this signal instead of overreacting to normal pain signals. And what this results in is that abnormal pain signaling goes down, and it results in chronic pain relief. I will talk about the clinical data explaining exactly how much relief people get, but this is the mechanism of action and the hypothesis that we're pursuing. And most importantly, unlike TENS machines or other technologies, it has got a pulsed signal, which means that your nerves do not habituate to the signal. Just like, let's say you put your coat on in the morning, in about a couple of minutes, you no longer feel it on your body. But what if I kept jerking or moving the coat around? You no longer feel that, you no longer forget that you're wearing the coat. So that's what the ActiPatch does of sorts. So overall, ActiPatch therapy reduces chronic pain and has actually been shown to improve sleep, physical function, and overall quality of life. And these are just, and the figures that you see on the screen are just some examples of how to place it on a variety of body parts. As you can see, knee, there's some for tendonitis or shoulder, there's a plantar fasciitis application, and then there's a back pain application. So it's the same device with the potential to be applied to multiple body parts. And so here, I'll just walk you through the clinical evidence and just show you what we've done so far. We've done a couple of musculoskeletal clinical studies, but broadly, we've done one on knee osteoarthritis, one on plantar fasciitis, and then an acute pain study on breast augmentation. We currently have a back pain study ongoing in Alabama, and the results of which we expect pretty soon, but we can say that the results look very encouraging. But just to summarize clinically, ActiPatch was shown to clinically reduce pain overall in all 3 clinical studies, and this was shown to be statistically significant. As you can see in the knee osteoarthritis study, we have a 25% reduction in the VAS score. In the plantar fasciitis study, we have a 40% reduction, and these are people with high levels of chronic pain. As an example, a 7 or an 8 out of 10. But if you see the box on the right, most importantly, we found that it's about 40% more effective than opioids, 85% more effective than oral analgesics, and almost twice as effective as topical creams or any heat patches. And in light of the opioid epidemic sweeping the nation, this is important because people who use ActiPatch actually have the potential to cut back on taking medications that may be harmful. So while this is the clinical data, we actually went ahead and did some real-world registry studies to just get a sense of how it performed in the real world. And this data was collected on about 5,000 patients in the UK. And as you can see, this was used in a variety of musculoskeletal conditions, like on the back, knee, hip, shoulder, and specifically for arthritis conditions and for pain following surgery, fibromyalgia, neuropathy. This was an open label study, so we didn't necessarily tell people what to use it for. People self-reported on what they've already used it for. The summary of the data is that 2 out of 3 users in this 5,000 patient population reported a 57% reduction in their pain. And we're talking about a reduction from about 8 to almost a 4. So we're talking about halving of pain. And more than 70% of these people reported being able to sleep better, 3/4 reported being able to move better, and a lot of them, specifically 65%, were able to cut their medication use in half. The important goal is ActiPatch is designed not just to provide pain relief, but to help people get back their quality of life by helping them move better. But overall, we have about 15,000 data points collected from 15,000 subjects over a 3-year period. And now to discuss about the contraindications of ActiPatch. There's 2 types of potential contraindications like any technology. One is from the signal of the ActiPatch itself. About 1 in 500 or more users report a temporary increase in pain. And in fact, this is indicative of the central sensitization nature of their pain. And this is likely because the ActiPatch is regulating nerve activity. So in a minor fraction of individuals, they may experience temporary pain increase. But we've also noticed that people who discontinue the device immediately get rid of their pain. So there's no lasting or harmful benefits from people who may feel this temporary pain increase. The second is with the physical contact with the skin itself. Since this is a wearable technology, it stays on the skin for an extended period of time. And oftentimes we ask people to put tape on or some medical wraps, etc. And this can lead to contact dermatitis from the adhesive or wraps in a small number of individuals, or it can lead to skin chafing for individuals who have an active lifestyle from the wire repetitively rubbing against your skin. Or people might have some trapped sweat or detergents or lotions underneath the wire, which can cause a small rash. But all of these are not harmful and have been found to be fixable by fixing it on loose clothing instead, or maybe just periodically wiping the device clean after a physical activity per se. So how to use the ActiPatch? It's actually really easy and involves just 2 steps. Step 1, you've removed the white tab on the back of the ActiPatch device. This was placed to prevent accidental activation of the device. So you can pull the tab out and you can discard it. And there's a silver button on the back that you can press for about 2 seconds. And once you release it, a green light comes on in the front, and that tells you that the device is on. And if it hasn't turned on, just repeat the step and press it for a couple more seconds, and it should turn on. Second, placement of the device itself. You can use wraps or bandages or any number of methods to place it to the body, but the important thing is to place the area of pain in the center of the loop. As you can see in the figure, this gentleman, the device was placed such that the pain rests in the center of the loop. Let me just walk you through a quick video that shows all the types of wraps or attachment methods that can be used to just apply the device to a patient.
Any type of wrap, bandage, plaster tape can be used to secure the device over the painful area. The device can be applied over tight-fitting clothing if that's preferable, and the device can also be removed from the wrap and applied to other painful parts of the body. The important thing is that the device is secured over the painful area. So whether the straps or belts are used that are provided with the various devices, or you use your own technique, employing band-aids, plasters, bandages, adhesives, it really doesn't matter. The key is what works for you, that is comfortable, and keeps the device securely in place.
Excellent. So as you can see, the important thing is being able to place the device on the source of pain using any method, and almost any method works. It's designed for 24/7, so we want the patients to be comfortable. So how to order ActiPatch for your patients? There's actually 2 options available. Since most people are generally skeptical of new technology, and especially since there's no sensations, we find it that some people are not convinced to try it. And so we came up with 2 versions. One is a 7-day trial version, which, by the way, these prices are discounted prices for medical practitioners and for the team at Comprehensive Pain Specialists. So we have the 7-day trial device, which is available for you to purchase for only $5. And then there's a 720-hour device, which lasts obviously much longer and has an on-off function. The 7-day device, once turned on, cannot be turned off, because the idea is to get patients to use it and see if it works for them. But the 720-hour device is exactly the same. It can just be turned on and off as needed. The purpose is to get people to use this over long term. For patients like knee osteoarthritis, we don't anticipate being able to heal them. But as long as we can keep their pain in control, we find that people use it overnight instead of 24 hours a day, 8 hours a day, 12 hours a day. So people customize it after using it for a period of time. Now, how do you place an order? You can let me know, or you can send us an email at info@blcorp.com, and then we will send you an account invite to create a customized account. You can activate this account on tryactipatch.com, and once you log in, you should be able to view your special pricing, and you should be able to order as many as you need. And this pricing is available only for medical practitioners. So that brings us to the end of this webinar. Thank you so much for your time. And if you have any questions, you can send us an email to info@blcorp.com or call us on this number, Or if you are interested in participating for any clinical research activities, you can email either Ian or myself at these two email addresses. So I am going to mute myself now and be open for any questions from the audience regarding anything that we presented so far. Thank you so much. Just in case there's any questions on how to ask the question, there's a chat box at the bottom of your GoWebinar, so you can click on that and you can send us a question. And once I receive the question, I will answer that publicly, so the entire audience can understand which question was asked and what the solution and what the answer is. Thank you. So we have a question from one of our participants on where is the best placement for migraine relief. So at this time, we're actually finishing the clinical trial on migraine, and we find that those that it works for, we try to place it over the forehead, because the idea is to affect the activity of nerves, the upper branches of the trigeminal nerve specifically in the forehead. So you can essentially put the device into a sports headband or just have a smaller version of the ActiPatch ordered, and then you can just place it over the forehead and tape it. And we find that in most people's cases, it might help prevent the number of migraine attacks as well as lessen the duration of the pain once the attack starts. We also have a question on the availability of the plantar fasciitis device. We actually have a small number of units. We do have a gel insole units, and we're actually in the process of redesigning the plantar fasciitis unit. So for small quantities, you can send us a request and our team will be able to check the inventory and send them to you. However, we anticipate the new redesigned product to be available in about 3 to 4 months. Ian and myself will remain on the webinar for about 5 minutes more, just to make sure that anybody who has questions can ask them. But this brings us to the end of the webinar. So thank you so much for your attendance again. And we will send this information list to our team, who will draw at random and let the person who wins the gift card, they will send them an email, and we will get the gift card to you. Thank you so much, and I hope you have happy holidays.